Perfect. Thank you so much. And I think we can invite Zach for the welcome to everyone.
Good afternoon, everyone, and welcome. My name is Zach Hennessy. I'm the Executive Vice President and Chief Strategy Officer here at Public Health Solutions. And I just want to welcome everyone to this joint combined session between our WholeYou Social Care Network and all of our both healthcare and community-based organization partners. I want to acknowledge that since many of us last met, there have been some big changes with the election, and ensure everyone that we are staying very well connected with the state and all of our policymakers as as news continues to roll out about the new administrations and the plans of the new administration. So as new policy developments take place, we will be communicating with all of you the potential implications that this has for the WholeYouNYC social care network, and perhaps ways in which you and your organizations and communities can be involved in any advocacy that's needed to continue our vision for Medicaid in making Medicaid more responsive to members' needs for food, transportation, and housing. So just wanted to make sure that we acknowledged that big news since last we met. And if you or your organization is interested in learning more, please don't hesitate to reach out and contact us. So welcome everyone to this session. We've got a lot to cover today because we have had a lot of development in the policy and implementation of the state's vision for the social care networks. So with that, I will turn it back over to the team. Welcome.
Thanks so much, Zach, for the introduction. And on behalf of my team also, I just want to extend warm welcome to everyone and thank you for your time today. We're very excited to have you here today, and we look forward to working together as a part of the social care network and in healing communities across Manhattan, Queens, and Brooklyn. Diana, if maybe we could go to next slide, please. Thank you. So we have a packed agenda for the day. We'd like to take a minute to introduce our growing teams to you who are supporting the social care network here at Public Health Solutions, among many others who are helping behind the scenes as well. We will provide a brief overview of the partnership models, share a few updates, and spend some time to go over the next steps with regards to the onboarding to the network as we prepare to go live soon. We also reserved some time for questions. I know everyone is eager to learn more about the next steps, and we will address these in our Q&A section, and then we will wrap up with the next steps. I also want to plug in a few housekeeping items. We ask that everyone please stay muted throughout the presentation and this meeting, but we will allow time for questions later on. I know questions also may come up as we go through these slides, so feel free to add them in the chat as we go along, and then we'll go back. We'll do our best to go back to questions in the chat. Next slide. All right, and I will now invite our Senior Director for WholeYou SCN, Allison Clark, who will do a brief intro to the team.
Thanks, Annette. Good afternoon, everyone. My name is Allison Clark, and I'm the Senior Director of the WholeYouNYC SCN here at PHS. I'm really pleased to welcome you and to introduce you to members of our team. In addition to myself, we have Gabrielle Miller. She's the manager of our Coordination Center operations. William Chambers, who is our Community Engagement Manager in Brooklyn. Michael Hernandez is a Community Engagement Manager for Manhattan and Queens. and Aneta Kutzwo is the member training and technical assistants who you'll hear much more from today. And now I'll hand it back over to Julia Keegan for the next slide.
Everyone. It's good to see familiar faces again. We're glad to have you here with us for this meeting. In addition to Allison and her team in the Healthcare Community Partnerships, WholeYouNYC side of the work, we also have a team that is called our Healthcare Community Partnerships Capacity Building Team. We are capacity building all day, every day, and we have a wonderful team who is going to be supporting primarily our healthcare providers who are part of the WholeYouNYC SCN. We have Christina and Kim, who are our two program managers, Candace, our incoming training manager, Natalie, who is our managing director, myself, our director alongside Desiree, and then Leah, our QI and evaluation manager. Next slide. We also have a group of wonderful practice improvement specialists, Marissa, Haley, Lindsay, and Stephanie, who are going to be really interfacing with the healthcare providers that are part of our capacity building offerings. And we should have more practice improvement specialists joining the team soon. Next slide. So I'm going to start with a really brief update on SCN partnerships. I recognize this may be repetitive for some folks if you've been joining our recent SCN meetings, or for some of you who have been a part of our Roadmap Advocacy Coalition for many years. But I think it's important before we start talking about the next steps in onboarding to level set and make sure that we share the most up-to-date information about what SCN partnership looks like and what the implementation of our SCN looks like at a high level. Next slide. So to start at the highest level in what the vision is for an SCN under New York State's waiver, we are gearing up for setting this coordinated infrastructure and set of processes, which is really aimed to identify individuals' unmet health-related social needs. I'll be referring to those as HRSNs throughout today's meeting. Connecting those individuals to services that they need and want, and making sure that organizations who provide those services can be paid. And I want to highlight that specifically because we know that this work and the work that your organizations have been doing has been going on for a very long time. There have been exceptionally strong partnerships and networks within New York City, and we're really excited to have the opportunity through the Social Care Network to provide payment points for those services that very often are either grant funded or not funded at all. Next slide. So to start with a really high level look at the SCN ecosystem, which surrounds our Medicaid members, which are in the center. Surrounding that, you have our social care network in blue, in that blue square, which includes the contracted partners who are working to deliver SCN services as part of PHS's WholeYouNYC SCN. So that includes the SCN lead entity, that's us, PHS. We have CBOs and healthcare providers, that is you all, and we will also be bringing in additional HRSN service providers to make sure that we have adequacy across the network in having service providers to meet all of those needs that are included in the enhanced HRSN services. Around our contracted network, we have those ecosystem partners that surround and support the work that we're doing, our managed care organizations, who PHS is working very closely with at the moment to establish our partnerships, local government organizations, child and family supports, larger health systems, and many other partners that there would just be too many to put on here that our SCN will be collaborating with over the course of the next few years. Next slide. And so we want to make sure that there's clarity in terms of what everyone's roles are and what our core functions are, especially for the folks who are here in this meeting today. So I will start by sharing a bit about what PHS's role is as the SCN lead entity. First, and this is something we've been working on very intently over the last several months, is our network development, operations, and governance. Several of your organizations are actually part of our governance committee that has been established over the past few months. PHS as a lead entity is also charged with coordinating the HRSN service delivery that happens within the network, making sure it's timely, accessible, and equitable. And to that point, supporting our partners and our providers with performance management, making sure that the services that are provided through our SCN are high quality, meet the needs of the folks that we are intending to serve, and meet the requirements for the SCN. There is, of course, data and technology infrastructure. We'll be talking a little bit about this today. I'm sure folks have heard about Unite Us, the data and IT platform that PHS will be using for our SCN, but there are a number of other partners in this area as well that PHS is working with to ensure that we are communicating data and ensuring that our network is informed by data both within and from without. Contracting and fiscal management, many of your organizations have already been involved in this through the participant agreement process, and I'll give a brief update on contracting for provider agreements in just a moment. And then last, but certainly not least, is the capacity building to meet the demand for HRSN services. This is what we're going to dive into a bit more today, especially the training and technical assistance piece, and there will also be capacity building through the avenue of direct investments. Next slide. And then for you all who have joined us today, our service providers, of course, the very important role of delivering HRSN services. A couple of the main points in service delivery are included here on the slide: getting consent from Medicaid members, screening for health-related social needs using a standardized tool, navigating members to HRSN services that they need and want, developing social care plans and managing those plans, as well as providing those enhanced HRSN services as well. You as our providers will also collaborate with us on data-driven performance reporting. So that's the other side of that performance management function that PHS serves. And then being active participants, providing input and collaborating as providers within our network. And there will be plenty of opportunity for that over the coming years. And some of it will be shared in a bit around what types of support PHS has to offer and the capacity building opportunities that, that your organizations will participate and collaborate with us on. Next slide. So the last thing I want to touch on in this topic is a quick overview of the member journey. Several folks may be familiar with this, but it's important context specifically for this conversation around onboarding and training. Some of your organizations may be providing one of these service domains. Some of you may be providing multiple or all. And so it's important to have just a high-level understanding of what the member's journey is through the SCN as we start to think as well about the trainings that PHS will offer and that your organizations will engage in as well. So the entry point for Medicaid members into the SCN is through screening. Medicaid members will be screened for HRSNs using a standardized screening tool. That is the Accountable Health Communities screening tool that will be used to assess for any unmet health-related social needs. If an unmet need is identified, the member will be navigated either by the organization that is providing screening. If that organization is not a navigator within the social care network, they will be referred to an entity that can further navigate them to the services that they want and need. So that leads us to the next step of navigation, which is where a social care navigator will determine the Medicaid member's eligibility for the enhanced health-related social needs service. So I haven't said this today, but those include our food, transportation, and housing services that are included in the fee schedule. And then navigate that member to the appropriate services based on the results of the eligibility assessment. Moving on to the HRSN service delivery, the results of that eligibility assessment will inform whether that member is navigated to and provided enhanced HRSN services, again, those services in food, transportation, housing that are on the fee schedule, or to other relevant federal, state, and locally funded programs that can support meeting their needs outside of the SCN funding structure. The trainings that I will turn over to Annetta shortly to discuss will go into far more detail on each of these areas, and there will be plenty of opportunities for us to talk about this. But we hope that this was just a helpful context to set before we talk a little bit more about what the next steps are for providers offering services in each of these domains. Next slide. I will very quickly provide an update on contracting because I know it's top of mind and I know folks have questions. So Diana, you can go on to the next slide. And I will briefly share that New York State has provided PHS with a template provider agreement for service delivery. PHS is in the final stages of providing our inputs to that agreement template to make sure that it's ready for our contracting with your organizations. Our contracting team aims to reach out in the next couple of weeks with guidance and next steps for contracting under that agreement. I know it's a binding agreement and it's a formal agreement and folks will have questions. And so there will be an opportunity for those questions to be answered once you all receive that contracting guidance and opportunities for PHS to solicit the input that we need for those contracts to get them executed. So that's all to say that there's no action needed on your part just yet. This is, I know, top of mind for you, it's top of mind for us, and we want to be sure that we're able to contract as soon as possible, and we will follow up with each of your teams as soon as we have an update on next steps and how to move forward with that contracting process. So with that, I will turn it over to Annetta, who is going to talk a bit more about the provider onboarding process before we turn it over to Q&A.
Thank you, Julia, for sharing the updates. If we could go to the next slide, please. All right, so shifting gears to the onboarding process and the milestones that lie ahead of us, I do want to preface this conversation with clarifying that these steps will generally apply to all of our contracted network providers, whether when we're speaking about network providers for the purposes of the onboarding steps, we're speaking about community-based organizations, healthcare providers, or another entity that will be contracted to provide services under the SCN network. And so this guidance will apply to everyone as far as the onboarding steps. Also to add to that, because I know there's different levels, different roles across the network, so these steps will also apply to folks on the network regardless of the chosen role. So whether you will be a screener, social care navigator, or providing enhanced HRSN services, or any combination of these, you will be asked to follow these steps. And so when we look at the SCN onboarding process, we look at 3 overarching categories. We have contracting, and thank you, Julia, for sharing the updates, what we know so far, which is currently under the way. And for purposes of this meeting, everyone here is currently undergoing that process, right? The next step is to ensure that we all have access to our IT platform, which is Unite Us, where we will be documenting members' journey and doing invoicing. And again, this is for the entire network. If there are any healthcare providers who are exploring any other approved IT tool, there will be a follow-up conversation about onboarding to the platform. And lastly, for the training, we also want to ensure that everybody, we start on the right foot, we feel ready and confident as we go live and start rendering services when we go live. Next slide, please. All right, so starting with the onboarding onto the platform, it's a sort of a 2-step approach, and it will slightly vary for organizations who are new to the platform versus those who are not. The only difference here is that the organizations who are new to the platform will be asked to provide the provider registration sheet to initiate the onboarding process. The provider registration sheet will be an Excel file with few short questions, and you see these questions here in the green box on the slide. And we will be sending these to you via email and asking you to send it back to our support inbox with one response per organization. We have a list of organizations that we see that are not currently on Unida's platform, and so we will be sending these requests based off that. If you do not receive a request from us and perhaps you're unsure if you should have taken action on this or not, you can always send us an email and we'll do our best to cross-check with you if confirm whether there needs to be an action or not at the time. And also, if you have any questions regarding filling out the PRS form, you can always send us an email as well. We're here to help along with our partners from Unitas, who are, I believe, also here on this call. So we can also, if there are any specific questions, we can also dive into questions. For organizations who are not who are already on the platform, we're sort of skipping this first step of completing the provider registration sheet, and we will be diving into the payment configuration on the platform. This will again be asking for a few additional questions, and we will follow up with each of you who is already on the platform to request that information from you in a similar format in that Excel file. Also, depending on where everybody is at during upon contract execution, we will also have shared detailed information as with regards to joining the platform as a part of your welcome packet that everybody will be getting upon executing their contract. Next slide, please.
No, no, I'm going to put it right.
In terms of the training, so I do
Huh?
also want to
Already
start a
ordered from yours
conversation.
because no, it's deliver. Yeah.
May I ask for someone
Yes,
who is unmuted to
please,
please?
everyone.
Thank you so much. In terms of the trainings, I do want to also say we are cognizant of everybody's schedules, and we're trying our best to make sure that we can fit our training schedules into our trainings into your busy schedules, also keeping in mind that there are some key elements that we all need to align on and make sure that everybody knows before we go live. There's few training objectives that we have here. We have the IT trainings with our IT platform with Unitas. First, you'll see here getting started with Unitas is that is an optional training that you can take whether you are brand new to the platform and you want to learn about all the functionality on it, or if you are already on the platform, perhaps you want a refresher. This is optional to attend, and we'll be sharing a calendar for that. In terms of the follow-up trainings, workflow specific with regards to everybody's role on the platform, whether you are a screener, navigator, or HRSN service provider, we will be having separate training modules for each group, and these modules will be divided into trainings offered by our Unitas partners that will dive deeper into operating and navigating the platform in our SCN workflow. And that will be followed by trainings from PHS, where we will be focusing on care delivery. And in our care delivery trainings, we will be taking into consideration some other aspects of providing services, such as providing person-centered care, some things to keep in mind when working with our enhanced populations, and some additional key concepts that go beyond just operating on the platform. Then we will also ask all providers who are providing services to children, families, and youth to complete child abuse and neglect training, which is a self-paced online course. So we'll be asking organizations to attest to completion of the trainings for folks who will be providing services in our network. And last but not least, we also want to acknowledge that a lot of our providers already may have an in-house HIPAA training. And so we would advise you to attest to the completion of these modules if you have that as a part of your onboarding or annual compliance trainings. And we will work with each and every one of you on a way to implement that. And we'll provide detailed instructions on how you can attest and what documents will be needed for that with your welcome packet. Also in terms of training, I also want to acknowledge that we're currently reviewing the ICOR capabilities assessments, your feedback that we've gotten from the surveys, from focus groups, and we want to use that to aid our more comprehensive training plan that will follow in the months to come. We will update our training plan and shared instructions in terms of which providers can attend, who will be the attendees specifically for each module, and what will be the objectives of the trainings. Can we go to the next slide? Thank you. So in terms of the training schedule, we are finalizing the schedule as we speak, and we hope to get this out to you as soon as possible with the dates for all of the modules that I've mentioned in the previous slides, and the links and instructions for the link for the child abuse and neglect training and for the attestation for the HIPAA. We also want to provide support on this onboarding journey to everyone, and we know that there will be many questions related to trainings, onboarding to the platform, and with that, along with our training plan, we will also share a calendar for onboarding office hours, where you can come with any and every question related to onboarding, and also questions related to completing your the Unitas platform and joining the platform. And we will also, again, it's an optional getting started with Unitas live sessions. They're optional, but we will also share a calendar for that. And I also want to share with everyone just overall in terms of training and technical assistance support that we're here. If you have any questions, you can email us at support, and I'll share the email in the chat in a minute. And through office hours, through email, and through trainings as well, we hope that this will be a very productive collaboration. And with our training assistance coordinators, our practice improvement specialists, training managers, and also many folks here at PHS also supporting the work and focusing on specific populations are here to help as well. Next slide, please. All right, so with that, I will invite Julia now to start going over the Q&A, and we will address some of the questions that we have gotten in the registration form, and also we are monitoring the chat and addressing some of the questions from the chat.
Thanks. And Dana, you can actually close out the slides for a moment, just so we can see each other and have this opportunity to chat. Thank you to everybody who's on video. I know you don't have to be, but we appreciate seeing your faces. We're going to take some time to go through some Q&A. We have plenty of time to go through this, so I hope we're able to address as many of your questions as we can. What I will ask is that I know folks have put questions in the chat. We've been doing our best, both our team and Unitas, to answer some of those questions. We'll do our best to repeat some of them out loud for folks who may not have been following in the chat. We had some questions that were submitted in advance, so I will start there. And then we will certainly take questions. If you would like to unmute yourself, I ask that you just wait until we ask you to unmute to answer or to ask the questions that you have. So I'll start with a couple quick questions that were submitted in advance. One is for where a list of the network providers can be found. And so this will be made available on the WholeYouNYC SCN website, which is soon to be launched, and all of our providers will receive an update when that happens. The providers will also be identifiable on the Unitas platform.
Julia, can I just
Of course.
augment your response there a little bit?
Yeah.
So many of you have participation agreements and you've told us what you're interested in providing, but you're not contracted yet to provide any one service on the fee schedule. So until folks are contracted to provide one of those services, at that point, we will publish it because it will be a formal contractual relationship that's a funded service agreement based on a service. And so we're not trying not to be, it's not that we're not being transparent. It's just that we want organizations to have an opportunity to review the fee schedule and the terms of the contract before we start sort of putting your names out there as official members of the social care network. I hope that's provides a little more insight and transparency into our thinking.
Thank you, Zach. Let's turn to a question that we have from you all here. Robert, I see your hand up. You're welcome to come off mute and ask your question.
Great. Thank you. Very, very helpful overview. So clarifies a lot of things. So I thank you for that. Two quick questions. One, if you're currently using Unitas, let's say on a smaller scale for certain programs, any insight into when or how to expand that? Because I see the different target dates. And regarding 11/22 and 12/5. And the second part of the question, is there any insight into infrastructure development monies? Do you need to be contracted first, or how do you propose for that?
Great, thank you. Happy to answer the Unitas question first. I know we have folks from Unitas on this call, or I will toss it over to Annetta to answer that question as well. But I think if we could have someone from Unitas speak to the first question about
Expanding.
Yeah, I can start with the first part of the question. Essentially, it will be predicated on the agreement. As far as, did you have in mind expanding your services as a part of the WholeYouNYC social care network? Did I get that right?
Yes.
Yeah. So essentially, the payment configuration will mirror your services that will be listed in the provider agreement for the social care network. So that will go in tandem. And that's something that will be worked as a part of that payment configuration where you will list, if you're already on the platform, you do not need to submit that initial form. But in the payment configuration, that's when you will come down to all the services. If you're enhanced service provider, what services specifically you would be doing, as opposed to whether you would be doing screening or social care navigation.
And I just want to be clear that at that point you will name your users and we'll work with you to define their roles. And there will not be a cost associated with there's no cost associated with licenses or anything like that. So
Okay, great. And the part about the infrastructure?
Yeah, of course. Yeah, for sure. So we are in the actually, Zach, would you like to talk a little bit about the process for infrastructure funding? I feel like you're the better person to take that question.
Sure. We are working with the governance committee now on the prioritization and allocation of capacity building resources. Many of you participated in a capabilities assessment with I-Core strategies. The information from that survey, as well as the focus groups with organizations, as well as the focus groups with Medicaid members, will be presented in December to the governance committee, at which point they will allocate the resources that we have budgeted for capacity building into the various categories of education, technical assistance, and capacity building that are required. And so you will not need a separate agreement to access those resources. It will be your ability to access those resources will be included in the template agreement that we work with you on. There will be a request process and an internal review of the requests that come in after the governance committee has finalized the allocations. And I know there's kind of parallel processes here. It's based on the state's fast and furious timeline. I want to assure people that we're not going to let people get left behind. I can understand being anxious, feeling like, oh, my organization needs to be ready on January 1st. We're not ready. It's going to be an iterative rollout. And if you're in need of capacity building resources, we're going to focus on getting you that first. I just want to reassure people that we will move at their pace of readiness, and that joining the network as well as receiving capacity building funds will roll out gradually. So if you request, there won't be like a single opportunity to request, and then if you didn't meet that opportunity, it's over for you. The request process will be an ongoing process so that people don't have miss windows of opportunity.
Right, thanks. So we could basically do a workflow with in-reach first and then potentially outreach with screening and then navigation as that infrastructure develops, correct?
Yeah, and we're happy to talk
Okay.
to any organization because there's such diversity in what people are thinking about doing.
Thank you very much.
It'll be different for everyone.
Thank you. And I know I see some hands up. I'm just going to take a couple questions from the chat before we move back to folks who have their hands up. There were a couple questions in the chat around the time commitment for trainings, if all relevant staff need to take them before the 1/1 go live, or if your organizations could take time to think about who to involve in those trainings and do some additional planning. So we are offering these trainings before the January 1st go live for those organizations who are, would like to come onto the network ASAP. If your organization is not ready to do so at the moment, we certainly encourage you to have a conversation with our team, but we will be offering these trainings on an ongoing basis. We know that you're going to have new staff and that there's going to be an ongoing need for these trainings. So we're really focused on what's happening pre-January 1st, but there will certainly be a long-term training and onboarding workflow and pathway for new staff or for organizations who may expand their service capacity over the course of the waiver period. If you would like to include a selection of your staff in these early trainings, that is great. We would want to ensure that it's those staff who are trained, that are those who are providing the service delivery under the SCN. But if you have any additional questions about that, again, feel free to put them in the chat. I'm happy to clarify further, or you can reach out to our support email. All right, Remus, I see you've had your hand up for a little bit. If you would like to unmute, you're welcome to ask a question.
Hi, thanks. Yeah, good overview so far is very helpful. I saw the reimbursement schedule that's been shared, but is there any information in terms of the referral pipeline that's anticipated? Whether there's a minimum number of referrals agencies could expect, an average, et cetera? Because, I mean, we need to plan and coordinate and schedule the manpower accordingly.
Yeah, so I recommend that you start not on the basis of our demand, but on the basis of taking a look at that fee schedule and kind of analyzing what that translates into and what resources you need to expand or grow your capacity. The reason I say that is because we don't think we're going to get a file that shows us the state's assessment of eligibility until after January. So we won't know how many members for our region they have identified who fit any of these kind of enhanced care populations. And we're not starting with screening all 3 million Medicaid members on day one. We're going to start with our contracted screening partners. And so we expect that volume will start out slow and grow gradually over time, as opposed to starting with the full kind of level of demand in the system. Yeah, we wish we knew how many folks were on that roster, but that we don't think the first roster will even get ingested until mid-January for us to view.
Thanks, Zach. I want to address a question that's in the chat, which is someone feeling confused about whether they are or are not contracted. And this is something I didn't mention in the contracting update section and is helpful to clarify. Several of your organizations may have signed a participation agreement in the previous few months, which was sort of our way to jumpstart this process and make sure that we were able to build these partnerships in the timeline necessary to go live for January 1st. That is a no money agreement. It is a partnership, a participation agreement, and the contract to be a service provider in our network is that SCN provider agreement that I mentioned will be going out in the next couple of weeks. So if your organization has already executed a contract with PHS, please be aware that was your participation agreement, and you will need to go through the process of executing an SCN provider agreement, which again, our team will be following up with your organizations about in the coming weeks. So please stay tuned. You haven't missed anything. That process is still to come. If folks have not received, just another quick answer from the chat, if folks have not received or seen the fee schedule, please let us know. We are able to share that with you all. I believe it was shared with folks who attended the CBO workgroup meeting last month. So if you need a copy of that schedule, you can put your information in the chat, or if you realize you don't have it at any time, you can email our support inbox, support WholeYouNYC SCN at healthsolutions.com or healthsolutions.org, excuse me. And that information is in the chat and will be in this the information that comes to you all after this meeting. Brooke, if you're welcome to unmute yourself and ask a question.
Thank you. And I just wanted to echo the thanks of these really informative Q&A opportunities. Related to my question in the chat, is the process for contracting for either screening and or navigation selective, or if we're interested and we would be able to? And then related to that, if we did want to do screening and feel ready to go on January 1st, do you anticipate that is a realistic timeline to be able to start January 1st?
So the contracting process is not competitive. We welcome organizations to provide those services that they have the capacity and the required licensure when it comes to the enhanced services to provide. I want to mention that, over the course of the contracting process, there will be plenty of information on this, that, there will be opportunities to build capacity around certain services that you may not have full capacity for now, or perhaps you haven't offered in the past. So that will certainly be something that is part of the capacity building support that we will provide, is to answer those questions that are needed and provide those supports to offer those services. So there will be opportunities to add additional services down the line. To your question about whether this is a realistic timeline, we realize that the date today, we're halfway through November, we're a month and a half away from that January 1st go live period. It is a really, really tight runway to get this SCN stood up for service delivery on January 1st. We are doing our best on our end to move those contracts forward as best we can, to get the information that we need from New York State in order to share information with you all and to execute those contracts. So if you have staff, again, if screening is within your organization's wheelhouse and you feel that you have the capacity to do that now, I encourage you to take the opportunity to fill out that PRS form for Unite Us. If you're already on Unite Us, we'll be following up with the payments configuration form soon. And to make sure you start to identify and think about the staff that would need to be trained in whatever area of service delivery that you intend to provide. So we will be following up with those registration links and schedules for training, but whatever planning your organizations can do now to think about who should be involved, we certainly encourage it because we realize just how tight this timeline is. And we appreciate your patience as we get the information that we need to support you.
Thank you.
Of course. Let's take another question from the audience. And I believe I'm trying to go based on the order in which hands are raised. So I apologize if not, but Rebecca, I see your hand up and you can go ahead.
Yeah, I have a question. I work for a federally qualified health center, and I was told that even the participation contracts were delayed for FQHCs. I don't know if that's correct, but that's what I was told before. And I think because that part is delayed, we can't move forward with anything else, like the capacity assessment or registering for the Unite Us provider. Like, we can't really move forward with any other pieces. Is that correct, or did I miss something along the way?
No, Rebecca, that's correct. And we were waiting for an outcome in the version 2 of the operations manual. We had in our participation agreement language around capacity building funding, and it wasn't clear if FQHCs were going to be allowed to receive capacity building funding. Well, version 2 says that FQHCs cannot receive capacity building funding. They can receive onboarding support, but not sort of direct funding like for personnel or equipment or things like that. So we're still trying to get clarity from the state. I'm meeting with them today around, what constitutes onboarding support. Like, is that money? Or is that just education and technical assistance? So, I apologize for, the delays that's caused in participation. But when we issue this participation agreement based on the template, or the SCN provider agreement, the template agreement that now everyone who had a participation agreement will receive, the FQHCs will also receive that agreement. So you're skip the step of the initial participation agreement, and within the next couple of weeks, we'll have that provider agreement out to you.
And I also want to add to that in terms of the onboarding to the Unite Us platform, the first steps that we can take are independent on the contracting process as far as submitting the partner registration sheet. And so for our next steps with the request to submit the partner registration sheet, we will be sending that over regardless of whether you have an executed contract or not.
Okay, so we'll skip the participation contract and we'll just move on to the provider contract, which others are doing. There will not be capacity funding, but you're waiting for details of what that really means. But at a minimum, there wouldn't be funding to hire staff. Okay, thank you so much.
Yeah, thank you for bringing that, Rebecca. I know you put it in the chat as well, so thank you for bringing yourself off mute. I know we have plenty of hands that are raised. I'm going to just do a quick answer to some questions that have short answers that have been asked in the chat. One is that if you already have identified staff who should be on Unite Us for the waiver, should you use this time to onboard them or wait for us to provide more input? If you are an organization that is already using Unite Us, you are welcome to start connecting staff that you envision may work on SCN service delivery that are not currently using the platform to participate in that getting started with Unite Us training. That is open and available to anyone. You would have to wait for PHS guidance around the SCN specific trainings. And again, that is to come very, very soon. We also had some questions around if we would be providing the screening tool, that Accountable Health Communities screening tool. Yes, we can provide a copy of that tool if your organizations are interested. It will also be part of Unite Us. That screening tool will be a template in Unite Us. And there was a question around how will we know if a member has enhanced eligibility. That is something that we'll be covering in those Unite Us and workflow trainings in terms of how staff can identify which individuals have met certain enhanced eligibility criteria. So that is certainly to come through those trainings. Let's take a question from the folks here. I know your name says Kimberly Matherin. I know you're not, so you can come off mute. Not actually Kim, but I can't see who that is, but your name in Zoom is Kimberly. You might not know who I'm talking about. Okay, I'll send the person a message. I'll skip to the next one. Harry, I see you have your hand up.
Yes, thank you, Julia. Just a follow-up question on Zach's comments regarding the referral process. Is there a set methodology on how the referrals will be made to providers, and also the assessing the capacity of the provider in regards to how many referrals they're able to take on? Is a methodology set, or is that a collaborative process between the provider and PHS?
It's collaborative. We don't want to inundate people with.
Zach, I can't hear you so well. I don't think folks can hear you. Something went off with your mic. You're just very quiet.
It's collaborative. We don't want people to get inundated with referrals that they can't meet. So it depends on what service specifically you're talking about, but some services you will be sort of required to determine with us what volume you can provide. Like if you're a meals provider, for example. Other things, there won't really be a cap. Like if you're doing screenings, we wouldn't cap you and say you can only do, X number of screenings as a part of your contract. But if you're like receiving referrals for a service that you provide on the fee schedule, we will be working with you on kind of what is your estimated volume.
Okay, so just a follow-up, I'm sorry, just specifically regarding the screening, say we have staff capacity to do, whatever number that's needed. How is that communication made? Do we say to PHS, we are able to do 20,000 screenings or whatever that number is? Or, well, let me stop there. How does that work? How do we communicate our capacity?
So in the attachment to the participation agreement is where you define what services on the fee schedule you're interested in providing, and your capacity. So we want to have as many of those open sessions when people post when people receive their contract. And we're also willing to meet with individual organizations if they kind of need help defining that. That's part of the technical assistance that our team will provide. So we want to work very closely in partnership, and it's not a simple answer because all of these services are a little bit different, and different services have different levels of authorization as well. So there are some controls within the platform that we have available to us as an SCN to kind of manage volume and approval. And, so that's technical work that's underway and being developed into the platform. So it's a lot of moving pieces and not a simple answer to your question, but it is in the contracting process that will be determining your capacity and the services that you'll provide.
Great. Thank you, Zach.
Thanks, Zach. And I want to answer another question that has come up a couple times in the chat that is whether there will be a roster or Medicaid members who are attributed to CBOs to conduct screening and navigation, and some questions around whether there will be a list provided or if organizations should be screening their existing clients. So PHS, so splitting up the roster, attributing individual Medicaid members to CBOs is not part of our approach. We are encouraging the organizations in our network to screen, navigate, and provide services to the members that they currently serve. There will be a way.
Did I just provide a little bit of justification for that?
Yeah.
We don't want to restrict access to these resources. So we really feel like if the first person who touches the member and conducts the screening is the best person to conduct that screening. And if we divide up the roster and say, organization X, this is who you're responsible for, that person is not going to have access through, other points. There may be, this is a learning process. So as screening data begins to come into us and the quality, and we can assess the quality of the information on the roster, that may allow us to do, more specific population health management approaches in the future, but that's not going to be the day one approach. So for example, with health homes, there may be an opportunity just to provide them with information about who in their health home is, eligible for screening, but we don't yet know the quality of the information on that roster, and we need some time to assess it to ensure a quality experience for members that doesn't impede access in any way.
Thanks so much, Zach. It's really important context. I am going to go to Siobhan. Has your hand up?
Hi, thanks, Julia. This is my first meeting, so please bear with me because I'm sort of working my way backwards. But I was wondering if there have been any conversations, not around capacity, but around catchment, so that if there are multiple CBOs within a particular community district, zip code, and getting referrals from healthcare providers, how is that going to get structured? What's the workflow to identifying what CBO sort of is first, second, or third, if we all have, let's say, more or less a similar capacity for screenings or navigation? So if you could talk through a little bit about that.
The navigator works with the member on their priorities and preferences. So when their eligibility is, when they're screened and their eligibility is assessed, Unitas will flag people who are contracted to provide the service, and there will be like a list by location, mainly by location, that the navigator will review with them, but they'll also consider things like language, accessibility, preferences. All that is really in the hands of the navigator. And then they will choose where to send that referral electronically. I don't know if there's additional information our navigation team wants to offer additional detail.
Thanks, Zach.
Thanks.
If anyone else wants to jump in, you're welcome to. I'm going to offer ask to unmute. It says your Zoom name is Kimberly Matherin. I'm gonna go and invite you to unmute. Let's see if this works. There you go. Yep.
This is Delphine. Maybe I'm coming up on the wrong number here. Sorry about that. So I have a question. I think I'm echoing what Anka mentioned in the chat, which is if we're already doing screening in our EMR and we're not on Unitas, and we don't have the capability, who will provide us with the technical assistance to enable us to flow the results to Unite Us?
And thank you for asking. And may I ask if you are with the community-based organization or
I'm a
healthcare
hospital.
provider? Hospital, okay. Julia, do you want to take that
Yeah,
question?
so we know that some of our healthcare providers are not intending to use Unite Us. Again, I want to reiterate that our community-based organizations are required to be on the Unite Us platform. Our healthcare providers have the option to use Unite Us or to interoperate through another alternative platform. It's going to be quite unique to the systems that you have in place at your organization. We know that across the many healthcare providers in New York City, there are tons and tons of electronic medical records and other systems that are used for care delivery. And so I think it would need to be a conversation that we have separately to make sure that we understand what systems you're working with and what the opportunities are there. Our team on the healthcare community partnerships capacity building side will be supporting healthcare providers, and we can support in having these conversations with each of your organizations. So it certainly isn't on our radar and a step in the process to ensure the next steps are there for healthcare providers who don't intend to use Unite Us. Zach, is there anything you wanted to add?
Yeah, just some technical detail. The only interoperable service currently that is mapped is screening. So navigation has not been mapped through the interoperability pathway that the state has created. And that information is flowing through the health exchange. So if you have to be set up with a QE and submitting your data to a health exchange. And then those screenings, you can be paid for those screenings through the SCN. If you're contracted with us, you're using the AHC tool with question 0, and you're interoperable with the health exchange.
Okay, so it has to be with the health exchange, not with Unite Us directly?
That's correct.
And then the navigation services would be provided by whom?
It will come into the SCN and
Okay, so it'll come through the health exchange itself.
Yeah.
As opposed to through Unite Us, I think is what I'm hearing. Yes?
Yes.
Okay. And then thank you for that. That's very helpful. Also, just quickly, we have a history, and thank you for mentioning that patient preference counts here, because what we've learned from experience, of course, is that, and everybody seems to have a preferred provider list by type of CBOs based upon the experience of our patients and where they live and what they want and so on and so forth. If there are organizations that are not on Unite Us, are the care navigators for the SCN going to be taking into consideration other non-Unite Us CBOs and preferences, or discussions at least with providers on preferences for those patients?
They wouldn't be, if they were not on Unite Us, they wouldn't be providing the new services on the fee schedule, because that's a requirement. So what you're really talking about then is navigating to the existing social safety net. And that can be to providers who are on Unite Us, or that can be to providers who are off Unite Us, and you just document an out-of-network referral in the platform.
Yeah.
So
I hear what you're saying. I'm sorry, but
there won't be any services of the new services taking place off platform.
When you say new services, and maybe this is the crux of the issue, there are many organizations that are not on Unite Us. And I know you're making an effort here, and hopefully the folks listening and others are going to be joining Unite Us, and therefore will be on the platform. So when you say new services, I'm trying to understand what that means relative to, opportunities or, need that's been defined. for these patients. We've been doing this for a while. If all the organizations are on Unitas, that's better, obviously, right? But some will choose not to be, I suppose.
And
So I'm
perhaps
not,
new is reimbursable, right? If you want to be reimbursed for those services under the SCN, it would be Unitas.
thank you for defining it. So it's reimbursable, right? So it would behoove as many CBOs as possible, if they can, to join Unitas, is what I'm hearing.
Yeah, and it'll be necessary to be paid for those services.
Well,
and
that's what she said.
that
So thank you
those-
very much for that clarification. Yep. Yep. So if there, and we can again provide information if there are organizations, as can others, if there are organizations that they would like to have on Unite Us to be able to continue that relationship, if you will, then that's something we can talk about going forward. Thank you. Thank you very much.
Thank you, Keisha, Zach, and Delphine. I also want to acknowledge that there are several questions in the chat that are either specific to a provider type or to a specific setting. There will be future opportunities to dive into some of these questions that perhaps are more specific to your provider type or setting. There was a question about what opportunities there would be to continue these conversations. And I believe Annetta mentioned that there will be office hours held and certainly future meetings like this to allow opportunity to ask and answer questions. So we have about 10 more minutes left for questions. I'm going to try to see if we can get to everybody who has their hand still raised. So Anna, why don't you go ahead?
Hello. I'm sorry if this question was already covered, and it was, I think, in parts touched upon, but I wanted to just be clear. What exactly does an enhanced care management service mean, and how is it different from the general care navigation? That's the first question, and then the second question is, for the food pantry stocking, for the service type, there is a range on the fee schedule in terms of how much funds per week can be reimbursed, and it was not clear exactly what that depends on. This might be a bit too granular for this meeting, so I'm happy to email this, but I wanted to clear that up. And also just for that food pantry stocking item, I wanted to clarify the eligibility is only for young people under 18 and pregnant women. So
Yes, so screening, remember it all starts with screening. So you get up to two sessions you can bill for screening. At the end of that screening, you'll know, or the goal of that screening is to identify if there's a health-related social need. If they are, you move into navigation. During navigation, you're assessing the eligibility, whether they are eligible for enhanced care services or whether they're navigated to existing social safety net. If they're eligible for enhanced care services, you can then provide enhanced care management because it takes a lot of time and effort to get people access to these new resources. So that's the additional kind of time and effort. Enhanced care management is the additional time and effort that your organization needs to get people access to these new services. If they're not enhanced care eligible at the end of those handful of navigation sessions, then your job is really using those navigation sessions to connect them to the existing social safety net. So this is if they're on straight Medicaid, as opposed to managed care, or they're on managed care, but they're not one of these populations. The units of the food question, it will be the range. It won't be variable within an organization. It will be variable based on the type of food box that you're providing. So if you're providing nutritional, if it's a medically or nutritionally tailored, if it is culturally tailored, those unit prices will be higher. So the variability comes into the kind of type of food service that you're providing within the category. And we've received some information from providers about where to set those rates within the window. But they'll be the same rate for everyone for the service within that range. For example, if you're providing halal meals, it'll be like a different rate than if you're not, or kosher, or clinically appropriate. So those are the factors that influence the price.
Thank you very much for that. And I'm sorry, I still have two follow-up questions. First, for in the enhanced care management, where can we find what the eligibility criteria for that is? Because I've seen the screening tool itself, and I've seen the fee schedule, but I don't think the eligibility is specified. Or I'm still not clear. I'm sorry about that.
Yeah, I think we should have an entirely separate training session about that. And I think it will be included in our training for enhanced care managers. It's all in the operations manual, which unfortunately we can't share. But each service has a different set of eligibility criteria beyond enhanced care population. So the navigation and the care management is a real specialized kind of role in assessing and verifying these eligibility criteria. Some information will be included in the platform on the roster, clinical information from the eligibility file, but other things you'd have to verify that are sort of non-clinical in nature.
I see. But so will the manual be released at a later point?
We don't know yet. We asked when version 2 came out, we said, is this one now going to be the public version? And they still said no. I think it's really going to be our job to take the operations manual and create training and materials for folks. That's how it's looking now. So that's our strategy.
Okay.
As Zach mentioned, it will be covered in the trainings as well. So thank you for your questions, Anna. I want to make sure that we give the opportunity to some other folks who've had their hands up. So I will ask Mara if you would like to come off mute and ask a question, and we'll take a few more. We'll try to take as many as we can before we move to wrapping up.
Sure, and I'll try to be quick. Oh, sorry. This is sort of related to the member journey flow as it relates actually to the payment structures. So just to want to be clear in my brain that the $17.50 per 15-minute unit, right, for screening is what's available for screening, and that does not include the additional sort of eligibility assessment. The eligibility assessment is included in the $17.50 per 15-minute unit that's available for the navigation and/or enhanced case management. Is that correct?
Yes, but there are multiple units. There's 2 units for screening and then a series of units for navigation.
Yes, right. Yes, there's multiple
many more units for enhanced care.
For enhanced case management. Yes, which makes sense. But that also brings me to my next question, which is just that is the expectation from PHS or maybe from the state that screenings will take only 15 minutes? Or I guess I'm asking, I have heard from a different SCN that consistent screenings that are billing for 2 units, right? If the screening is taking longer than 15 minutes and we're billing per screening for 2 units because it's taking 25 minutes, is that going to be sort of flagged as potentially fraudulent? What is the expectation there? Because I think a lot of us are anticipating screening to take longer than 15 minutes in many cases.
We've been working with Unite Us on how the time gets clocked in the system. But no, I mean, if you're spending more than 15 minutes, you get into that second time block of service. It's two units.
Okay.
Okay. Yeah.
Great, that's helpful. And sorry, one more follow-up question, just really quickly. You mentioned that the governing committee is making decisions around infrastructure funding and how to allocate into those discrete categories. But then is there a second, I assume there's a second step of allocating from those categories to each CBO? And I just wonder if there's detail on how that will be decided, like how much each CBO will get within each category.
So in addition to ICOR's report to the governing committee, there will be a report to all of you.
Okay.
That explains what the priorities were and the criteria. So then that will also be used when there's going to be a lot of requests, and we're going to have to decide which ones to honor and which ones to not. But we will be using these criteria, and there will be a process for justifying the request, so that we can evaluate
Sure.
each one.
Okay, thanks. Appreciate it.
All right. We'll take another question, perhaps two, depending on how quickly they go. Shaylin, I see you've had your hand up for a bit.
Yeah, thanks everyone for facilitating this. Is there a licensure or credentialing requirement of the staff carrying out the screenings or the navigation? That's one question I had. And in the case of home care, for example, where there's caregivers already being reimbursed by Medicaid for the time that they're spending in the homes of eligible members, is there any issue of like double dipping or billing for the screening and navigation services during that same time frame?
I can take the first part of the question. And thank you so much for bringing that up. There's two parts of that. One part of credentialing is the overall contracting process, right? When you're working with where you're working with our contracting team to make sure that all the compliance documents are in place. And the second part is that onboarding part where we're speaking about making sure that your organization is on the platform, that your team is being trained, and for that we will ask you to have a designated team lead on your team who can document and track the trainings for the onboarding trainings that we are doing, and also for any staff that can come on at a later point, that they can also be a part of that. And we'll make these trainings accessible at later dates as well, just to keep in mind those who may join the team later.
And I'll add when it comes to individual credentialing as well, that there is, so in the New York State Manual, first of all, there's requirements around like organizational licensure and ensuring that if services are being offered in those settings, that they have the appropriate licensure. When it comes to individual credentialing and licensure, Zach, I saw you come off mute. I wonder if you wanted to jump in.
No, I was going to talk about double dipping.
Okay. So, yeah, so we will, we can circle back on the question of if there will be a process of PHS assessing individual credentialing. As Annetta said, there will certainly, as part of the contracting process, be necessary to assess organizational licensure. And we'll be sure to follow up on a process for assessing and monitoring individual licensure for providers. Thank you for asking that, Shaylin. And Zach, I'll pass it to you for the double dipping question.
Between version 1 and version 2, this shifted a little bit. So people were really concerned that they wouldn't be able to be paid for screening and navigation because they were already providing some form of case management that was funded. The nature of the eligibility assessment here is so unique. The services are so unique that the state has really decided that this is incremental work. So the term that they've used now is that this is incremental work for case management or care management teams. So it's a different form of case management than existing care managers and case managers are doing. And that's good news.
All right, let's very quickly take one more question. I know we're running close to the end of our time, and I want to give Annetta a few minutes to wrap up. Jill, Bonnie, and Emily, I see all of you have your hands up. Jill, You are first on my screen, so I'll offer you to come off mute. Bonnie and Emily, if you'd like to put your questions in the chat for us, we can see if there will be an opportunity to get back to you on any questions that you have. But for the moment, Jill, I will let you go ahead.
Thanks. Mine's very basic and quick. Contracting wise. So we had signed a document at the beginning of October that was like an official looking document that I thought was our contract, but I just opened it up again and I see it actually says participant agreement at the top of it. So is that our contract or is that our participant agreement?
Yeah, and quick answer for you, it's not your service provision contract. Some CBOs signed participation agreements, which helped get you into the work streams for certain SCN startup activities like the capabilities assessment, but it's not an agreement related to service delivery. So all providers, CBOs, healthcare providers, anyone who did or did not complete that participation agreement will have to go through the contracting process for an SCN provider agreement. So going forward, it will be level set. Any provider that wants to join the network will go through that contracting process.
So are we still going to receive additional document that we'll have to sign to be part of the contract?
Correct. Yep. Exactly. Did you want to add something?
That you don't need to apply to anything again.
Okay. But we'll receive another document that we'll have to sign that will be our official contract.
Yeah, and our contracting team will follow up in the coming weeks with more information, guidance, and next steps for that contracting process.
Okay, then the only other question, also very simple, is we need to also get on the Unite Us partner registration sheet. So how do we make sure that we receive the correct staff at our organization? Is there someone I should email?
Yes, you can expect that shortly after this meeting, the template and the instructions as far as how to submit that. And so that is underway.
Okay, great.
And Jill, if you're unsure if it's your email address that it would come to and you want to make sure that you get it, you can send an email address. Annetta, will you put one more time in the chat that support email address? Yeah. I'll wrap the Q&A by saying that if there's any questions that you have, please reach out to the support email that Annetta is about to put in the chat. We will do our best to keep answering your questions. I hope it is appreciated that we had more than expected time in this session to answer some of these questions. And we will be having, again, office hours, ongoing meetings like this where we will be able to share information and answer the questions that you do have. So with that, I'm going to turn it over to Annetta quickly, who will wrap us up, share some of those next steps, and we'll get you going.
Yeah, thanks so much. If we can go to the next slide, please. And again, just to echo Julia, thanks so much for a very what I feel like a fruitful discussion, and I'd love to keep this going with everyone. So feel free to send us an email and we'll share the dates for the office hours. In the meantime, I just wanted to reshare sort of the next steps for all of us in terms of the next steps that we are making with our teams, and also as far as what you can expect from us. So in terms of the platform setup, we will be sharing the partner registration sheet. Again, that can be completed independently of the progress with the contracting, and also we will follow shortly with the payment configuration requests for the Unitas platform. With the PRS, initial PRS, we're looking at 11/22. Let us know if you have any trouble completing it. For the payment configuration, we'll be looking at the deadline of December 6th. Next up with the onboarding trainings, we will be sharing our training schedule with you. Again, it'll have more details, registration links, the times, of course, and the targeted audience for that. So who on your team you would like to see on those trainings. And for contracting, you can expect to hear back from our teams with regards to the provider agreements. Yeah, so I thank you again, everyone, for your time. We look forward to continuing working with you and changing lives. And again, here we have our email. For all the tech training and technical assistance questions, you can email support WholeYouNYC@Health Solutions. Along the way, once we go live, if you have any member-related inquiries, any member-related questions, we also have get info WholeYouNYC inbox at your service as well. Thank you so much, everyone, and I hope everyone has a lovely weekend.